Now let's learn Ren meridian. As a routine, we still learn it from two aspects. First is the causes of the meridian. The second is the acupoints on it. For the causes of the Ren meridian, it starts from the inside of the lower abdomen and then out from the perineum along the front middle lines of abdomen and chest. Go upward to the metalabial groove around the lip, through the cheek to the infraorbital region. The Ren meridians before we named its conception vessel. The Ren in Chinese refers to Renshen, its conception. So this meridian related to the growth and development, the menage and the formation of the male characteristics, female characteristics. For the acupoints of these meridians have 24 points altogether from Ren 1, Hui Yin, and stop at Ren 24, Chen Qi. Those points located on the middle lines of the front of the trunk. The points we will learn is Ren 8, Shen Que. For the location of Ren 8, it's easily to be located. It's in the center of the umbilicus. For the indications of Ren 8, the first trait is the flaccidity of the papillary and coordinates of the four extremities. When we treat that problems, we ask the patient to lie down with the abdomen to expose the umbilical. Then we use the crude salt to make it into powder, then fried it. And when it cool, then we put it into umbilicus until the salt is the same level with the abdomen. You know, in clinic, we can make some patients, the umbilicus is outside of the body. So at that time, we can make a dove around the umbilicus, then stuff it the prepared salt in it. And then we can put the moxa cone, the big moxa cone. Then we put the big moxa cone on the salt. When we lighted it, when the patient feels a slight warmer, then change the cone. Generally speaking, we will use about 3 to 9 cones. That's enough. But for some emergency cases, we can use more cones. Even we don't care how many cones we used. Another problem is the salt. With the fire, it will be exploded, and that may be burn the patient. So we can put a slice of ginger on the salt, then put the moxa cone on it. The second indication is of these points is to treat the chronic diarrhea. Especially to treat the chronic diarrhea is the patient pass stool in the early of the morning. It's about 3 to 5 o'clock in the morning. In TCM, we named it 五根泻, the morning diarrhea. At that time, that diarrhea is caused by the spleen and kidney yang deficiency. At that time, we can combine with stomach 37 and stomach 25 and also do 4 together to treat it. The third indication, we use the point to treat the itching. We don't care it's urticaria, eczema, or neuralgia, or the itching due to the old age. Just the patient have the itching on the skin, we can use the cupping on 神阙, on Ren 8. These methods have very good effect to stop itching. The lastly is the methods on these points. You know these points in umbilicus. This place is hard to be sterilized and easy to catch inflammation. So the feed foam needles is prohibited to be used. While we always use moxibustion like the moxibustion on the salt, and cupping also can be used. That's all for this point. That's all for this meridian.